Hi, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
And
therapist.
together we are the most famous physical therapists on the internet.
In our opinion, of course,
And
Bob.
we're not pregnant, but we are physical therapists, so we feel like we can talk about this subject. We're going to talk about, for those of you ladies who may be pregnant and are having back pain, which is very common, of course, with
Right.
it. We're going to show you the top three exercises we think you can do for this. Very they aren't going to be harm the baby at all.
Right.
Very easy to do. And basically what we're doing is we're covering the three areas that might give you pain.
Sure.
We're covering the SI, sacroiliac, we're covering the low back, and we're covering the mid back. So we'll start off at the lower, the SI, which tends to be quite often the problem.
Right, that is common.
You want to throw me a pillow, Brad?
Sure.
I want to be comfortable while I'm showing this exercise.
And that's a good point, Bob. All these exercises should be comfortable and they should not produce any pain. They should feel good, they should give relief. If they are uncomfortable, you should not do them at all. Just skip this one.
All right, so what you're going to do, you're going to lay with your legs flat. You're going to bring one of them up till it's about actually just completely vertical like this. You're going to grab onto the knee. And now if my hand wasn't here, I'm actually going to pull the leg down this way.
Right.
So this is going to stop the leg from pulling down. I'm going to pull down about 50% of my power.
Right.
You don't need to go 100%. And you pull down, you're going to count to 5. 1, 2, 3, 4, 5. Believe it or not, what that's doing is it's putting some stress on the SI or moving the SI.
Right.
So you're going to do 10 of these, 5 seconds times 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Yeah, again, if my hand wasn't there, I'd be pushing down this way.
Right. So
Finish that leg, then go to the other leg.
it's like an isometric, but you're not going 100% effort, about
Right.
50%. And when you do this, it should feel relief. You know, if it's hurting, you should stop doing it.
At least not make it worse.
Right.
If you don't get relief, at least don't make it worse. So right from this position, then you could go into this position, bring both legs up, and your back hasn't beginning the movement. It should probably because you're pregnant. So this is just a gentle way of getting some motion in your low back. Just gently go back and forth. If it feels good, you can go even further, give a little stretch, but just gently rock back and forth. This often feels really good on the back.
And we're going to do about 10 to 20 repetitions.
Yeah, you can do this a lot. A good one to do before you even got out of bed in the morning. So that covers the low back. The first one covered the sacroiliac. And now Brad's going to show the one for the mid back, which is often a problem too.
Right, so we're going to get on you could do it on the bed if you got a firm bed or carpeted floor works better yet probably. And you're just going to, we call it the cat and the camel one where you arch up like this, and the other one you go the opposite direction.
And sometimes people dip their head down when they go is that considered the camel or the cat?
I think this is the camel.
I never remember which one is which.
Right.
And then you arch down. So he's trying to get motion right in this part here, because this is the part that quite often is the bothersome part with the pregnancy. Everything gets thrown off with the weight being pulled forward, on your back. So try those 3. Hopefully they give you some relief. And if you haven't already, please subscribe. Slap that subscribe button. Thanks a lot.